Hi everyone, my presentation is on the treatment and prevention of obesity using phytotherapy. First off, what is obesity? Obesity is often characterized by an abnormal amount of fat compared to overall body weight. This is often seen as comparing how much fat makes up the total weight of the body. Another thing to consider when talking about obesity is looking at percent fat versus percent muscle. Someone might weigh a lot, but that might be because it's mostly muscle. In that case, their BMI would not be as high as it would be expected with someone that has a higher percent fat versus percent muscle. Obesity has a lot of detrimental effects on the body. We'll talk about those later, but one of the main ones is cardiovascular disease as well as diabetes. In this figure, you can see that there's many physiological consequences that can come about as a result of having obesity. Obesity might not be the direct cause of all these different things, but it can increase the chances of someone developing one of these. These life-altering complications have much more serious complications that can result due to the patient having obesity. As you can see here, things like heart disease, stroke, cancer, liver disease, even type 2 diabetes, they all have some serious altercations that can occur, even death. Some common systemic issues that can arise due to obesity is coronary artery disease, hypertension, sleep apnea, which in some severe cases can result in people choking to death in their sleep, and diabetes and heart failure. And then on the right, you can see here that there's a biochemical pathway of what happens if there's too much fat in the body. You can see that too much fat is broken down, which can lead to more blood-based disorders such as having higher liver toxicity or developing heart blockages or issues maintaining your blood sugar, which will result in diabetes, or just the increased mass around the airways can lead to stuff like obstructive sleep apnea or even systemic pulmonary hypertension. This is a more specific biochemical pathway that shows how sugars and fats are broken down and stored into the body as triglycerides, which are what you would think of as body fat. This is the demographic distribution of age and gender of people that have obesity. As you can see, it's well over 30% in all categories, but it seems that women, and especially women over the age of 40, are the most likely demographic to have obesity, with men in their 20s to 40s having actually the least likely chances of having obesity. Looking at demographics based on ethnicity, you can see that there's actually a very big separation between all the different races. If you look at, if you take white people as the median here, you can see that black people are far above average compared to white people, and Asians are far below average compared to white people. Especially African American women, they tend to have a much higher rate of having obesity, reaching almost 60%. Throughout the world, the United States is known as having the highest rates per capita of obesity, but not only that, they have the highest increase in obesity per capita. If you look at this map between 2011 and 2018, the rates of obesity went up almost all across the country, with an extremely dense region spanning from Texas to Alabama in the south. One of the major risk factors that is attributed to obesity is genetics. Genetics can actually lead to a lack of appetite, but it can also lead to a lack of satiety as well. It's not very common for there to be genetics having a role in obesity, which it's just 2 to 3% of people have the genes that are linked to having obesity. But it's also just as common, which is 2 to 3%, for people to have genes that are linked to anti-obesity. If you look at the figure on the right, this is referring to phenomena where basically it's very obvious to see that some families all have a similar body weight, but this could also be due to environmental influences. The major risk factor really for having obesity is lifestyle. In most cases, food choice is the main factor in differentiating between a healthy lifestyle or a poor lifestyle. While it is important to maintain a healthy ratio of fat, carbohydrates, and proteins, calories are most likely the cause of people's obesity, seeing as if you eat over your daily recommended intake, you will gain weight no matter the case, unless it's substituted for exercise. An important environmental risk factor to take into consideration is that, especially in the United States, portion sizes are way larger than they need to be. This essentially leads to an intake of food that is above what's necessary for someone to feel satiated. If you look on the left on figure 10, you can see that from the 1950s to now, serving sizes have doubled or tripled, or in the case of drinks, they've been multiplied by 6, which leads to much more calories being taken in than is necessary. And as you know, more calories means more weight gain. The number one prevention method among almost all the studies that I've looked at is diet. This is because obesity is almost always caused by someone having an unhealthy diet, and if someone were to increase the fiber levels and healthy fat levels while decreasing their calories, in most cases people will lose weight. That makes this one of the best prevention methods when trying to prevent someone from getting obesity or other weight-related issues such as diabetes. Another very important, if not just as important prevention method is exercise. There's several studies that have found that if people live in an area where they need to exercise more to get around, like if you live in a city where you wouldn't drive as much, where you'd rather walk to work or walk to a park with your family, then they're less likely to develop obesity. Also, another side note is that more exercise also reduce the chances of certain types of cancers in the digestive tract, and that could possibly be linked to the lowered risk of obesity. The allopathic treatment for obesity is actually called general dieting, which you might know of this from in school. We used to have the food pyramid, but now it's the My Plate, which you can see here on the left in figure 13. It's basically splitting up how much macronutrients you should eat. So you can see that there's a relatively large amount of vegetables and grains, and then some fruits, protein, and dairy. However, studies found that this doesn't really work for most people because people's diets need to change depending on the person, and also that, but it does work. It's very effective in raising awareness that healthy eating does need to be focused on, but it doesn't usually produce any results in helping people not be obese. This is a table showing the 5 different plants that I chose to complete the study on obesity prevention. The 5 plants were lentils, green tea, oats, avocado, and carrots. And for this slide, the important thing to note is the therapeutic categories. Green tea is a stimulant and an antioxidant. Lentils is also an antioxidant while also being anti-inflammatory. Oats are a dietary aid. Avocado is also a dietary aid, and carrots are known to be diuretic and antioxidant. These will be gone into detail further in the next slides. The first plant is green tea, otherwise known as Camellia sinensis, and you can see in figure 14, it's a relatively normal looking plant. Its leaves are the plant part used, and it's used for all different types of tea. Depending on how it's dried and grown, it can be either black tea, green tea, or brown tea. It originates in Southeast Asia, and its biochemical pathway in the body is it actually inhibits pancreatic beta cells, and so it can lower blood sugar levels or actually increase them in some cases. But overall, it helps helps the blood sugar levels remain stable. In a study that I found, green tea was actually found to increase satiety and also reduce appetite, which would be perfect for preventing and treating obesity, as the less people eat, the less calories they intake and the less weight they gain. It costs $29 per pound of the dried herb, but that means that it costs 28 cents to make 2 cups of tea, and 2 cups of tea is the daily dose recommended to help lose weight. However, it does require a total lifestyle change for the complete effect. The second plant is oats, and it originates from Central Europe, and it has been used for centuries as a very nutrient-dense and high-calorie food, but biochemically it contains glutenin proteins, and these proteins the body doesn't metabolize into fat as often, which means that you get a lot of calories and you get a lot of nutrients, but some of those calories aren't actually made into fat, but they will still be metabolized for energy. In a study, oats were found that they actually helped reduce people's body weight. This was due to that glutenin pathway that I talked about. And here you can see the nutritional facts. And in half a cup of a serving, which is a very filling amount, it has 180 calories and 3 grams of fiber and 5 grams of protein, which is a lot for something with such little calories. And it costs 36 cents per every half cup, which is a little bit more in green tea, but that's still very feasible as this is pretty much enough for a single person's breakfast. And just like green tea, it requires a lifestyle change for the total effect. Next up is carrots, and carrots originate from Europe and southwestern Asia, and the part that's eaten is the root, and the root has a very high sugar content, but it has very high fiber content as well. The high fiber induces a faster metabolism of food, which can increase excretion rate. Basically means that it'll help you maintain a steady metabolism throughout the day, which means you have steady energy while also not really feeling too hungry. Coming back to that high fiber, you can see here that in the nutritional facts in figure 20, that for only 52 calories, a whole cup of carrots has 4 grams of fiber, which that's over 10% of the daily amount recommended. A negative for carrots is that it costs $1.47 for a full day of the recommended serving. So the recommended serving is half a cup per sitting. And so if you did that 3 times a day, you get a cup and a half, which costs $1.47. Just like the other two plants, it requires a full lifestyle change to show significant effect, which means you won't see results instantly, which is pretty much expected from most diet-based studies. Another thing to note though with carrots is that they should be bought organic, because as their root, they absorb a lot of what's around them. So if it's not organic, they could be using pesticides, which can be toxic.